Hey friends, Dr. Christy here, and today I want to talk to you about the rotator cuff in your shoulder, okay? So many people come into my office and they complain that they've torn their rotator cuff. And I ask them, well, what part of your rotator cuff? And they just say, the rotator cuff. Well, the rotator cuff actually is composed of 4 different muscles. The shoulder itself is a ball and socket joint, and it doesn't really sit on a shelf. And the only reason it stays in that joint is because of these muscles that literally hold it in place. And so if your core is weak or you're not doing enough things to keep yourself balanced mentally, emotionally, physically, structurally, and even nutritionally, these muscles will start to get strained and it'll start to pull, and it'll literally cause those muscles to tear or get pulled more easily. That's why these things become so much more common as we age. So of these 4 muscle groups, I'm just going to give you a quick synopsis of what these 4 muscles do, what they're connected to, and then what you can possibly do to strengthen them in yourself if you don't have a tear to the point that it requires surgery, because sometimes rotator cuff tears do require surgery. Oftentimes I find that they're not necessarily surgical, especially if it's in the early stages, or if you're young and you can still kind of move it around. It's just a mild tear. We can regenerate those tissues. So number 1 is the supraspinatus muscle. That is actually up in the back part of the shoulder, and it comes across the back, the top of the shoulder blade, and it comes into the side of the upper shoulder right there. That's related to your brain. So nutritionally speaking, when we think about this, anything that supports your brain, I would say fish oils, brain concentrate, things of this nature, okay? Other one is subscapularis. This one actually, literally, if you're looking at the shoulder blade from the front view, it attaches to the entire front side of your scapula, of your shoulder blade, and then comes in and sits right into that little groove that you can kind of feel back and forth. That's where that attaches. So when that muscle is specifically related to the heart. So any kind of heart-related nutrition would be appropriate for this. Even vitamin E, carnitine, just flat out good aerobic exercise, things of this nature. Another rotator cuff muscle is the infraspinatus. So once again, we're going back to the shoulder blade. If this is the front of the shoulder blade, your infraspinatus is the back of the shoulder blade. Attaches all the way there and then comes up and sits right in that similar spot to the supraspinatus, but just a little bit lower. And then last but not least is, the infraspinatus is related to the thymus gland, which is all about your immune system. So anything that's going to help support your immune system, critical. So vitamin C, something obvious like this, right? And then lastly, teres minor. That's a smaller muscle. And if this is your shoulder blade, once again, on the very bottom of it, and it comes from the back up again, once again, into the outside upper part of the arm. That's thyroid related. So anything that would be supportive of your thyroid gland. So we're talking iodine, potentially maybe selenium, things of this nature to help support thyroid function. So what are we really talking about here? The rotator cuff muscle is really, really critical with hormones, brain health and nervous system function, your immune system, and your heart. Really huge systems that govern your entire body. And so if any of these things are off in you, like I said, physically, nutritionally, or even mentally and emotionally, you might be vulnerable to having a rotator cuff tear. So it might not just be something that you threw out in the gym if you're doing a bench press or if you're doing overhead press and you suddenly feel that shoulder pain. It could be one of these things is off nutritionally or energetically speaking. So questions, drop them below. Hopefully this was helpful. And I often recommend don't just jump into taking a bunch of these supplements without consulting with your physician first, because there is not a one-size-fits-all approach to everyone. So just giving you some information as far as my clinical experience is concerned. So have a good day, and I'll talk to you soon.